It is October. October is Breast Cancer Awareness Month, and new testing could be a key as far as survivorship.
Joining us now is our 9 News medical expert, Dr. Payal Kohli. We're talking about genetic testing. This has really evolved and changed and grown in recent years.
Very much so, and it's one of the pillars, I would say, of breast cancer prevention now, is to find the right people to do genetic testing on and make sure that they actually get their genetic testing. So if you're someone who thinks you might need genetic testing, and there's sort of two groups who should think about it, I would highly encourage you to talk to your doctor. So, some people have already had breast cancer actually get genetic testing if they've had it early, if they have a breast cancer called triple negative, estrogen negative, progesterone negative, HER2 negative, then that's a more aggressive cancer. They're recommended to have genetic testing for recurrence. But you should also get genetic testing if you have a family history of early breast cancer, especially if you're Ashkenazi Jewish or Eastern European descent, or if you've had ovarian cancer, because the BRCA gene, which is a common one, actually overlaps between.
Why wouldn't you get genetic testing? I mean, how difficult is it? How expensive is it? But why wouldn't you, even if you don't fit into one of those categories?
So a couple of reasons. One, is it effective on a population level? Because we're just starting to learn about which genes cause breast cancer. So let's say you do a genetic test and it comes out negative. I could give you the impression that you're not going to go on to have breast cancer,
right,
whereas there's many other genes that could have been causing breast cancer that are not checked. And this is one of the challenges with the at-home genetic testing for breast cancer. It only checks a few genes when we know there's over 1,000 mutations just in the BRCA gene.
So you don't recommend the at-home genetic testing for breast cancer?
Not at all. In fact, I mean, there's many reasons not to do it. One is the sense of false security or false negatives because it's just a small number of genes. But the second is when you're getting genetic testing, it's a big decision because this is a genetic diagnosis now. It's going to affect a whole lot of things. And sometimes the genetic test won't come out positive or negative. It'll come out either indeterminate or it'll come out a variant of unknown significance, meaning you have a mutation, but we don't know what it means. So interpreting that on your own can be really daunting. So definitely do this in consultation with a healthcare professional.
And usually you do need to get a referral. I did after my sister, and then I have checked 2, which means I'm at a higher risk for colon cancer and breast cancer, but it changed how I screen after that, so it's helpful. I think some people are scared though.
Very scared.
I mean, people say, I don't want to know.
Well, I would say that's the wrong attitude. For Alzheimer's, maybe that's the right attitude because we don't yet have a treatment. We may not change what we do based on your genetic testing, but for breast cancer, definitely. It's an easy test. It's a swab in your cheek or it's a blood test. And it could completely change the way we think about screening you because we could start earlier. We could check with MRIs and ultrasounds instead of just mammograms, and we could check your family members. So if you're not doing it for yourself, do it for your family members.
See, when you say it's a referral, it doesn't strike me, and when you talk about a swab and what we do with genetic testing now, that it wouldn't be all that expensive.
It's not that expensive, and if you are in the indicated groups, which we've talked about, they use a risk calculator and then they talk to you and you're in one of these high-risk groups, then your insurance should hopefully cover it. But even if it doesn't, even out of pocket, the cost is not all that expensive.
So at home, you're also interpreting the results yourself, as
I don't
opposed
want
to
to hear
having a doctor interpret a broader test is probably a more complete look at what you need.
Well, definitely. And not only that, Tom, it's more complicated because it's not just one gene you're testing. So BRCA is what's called a tumor suppressor gene. It repairs damage in our breasts and our other tissues. So when the gene is mutated, you're not repairing cell damage in the same way. But there's lots of other genes for breast cancer. And the way we do genetic testing is actually more than just everything for everyone. So if you're an Ashkenazi Jew, we might only test 3 specific genes that are higher risk in your population. If you're a postmenopausal woman who's already had breast cancer, we'll test 50 candidate genes, and otherwise we'll use kind of a general genetic panel. So different for every person, which is another reason not to do this at home. Really talk to a professional about which genes should you be testing and how.
Yeah, and a lot of people have made decisions. I know sisters in many cases, when another sister and you find out you're positive, and it could become from the father's side of the family, they've proactively said, okay, I'm going to take my breast tissue away and move ahead. So
well, Angelina Jolie is a famous one who did that. And, talking about not just breast cancer, but also ovarian cancer risk if these turn out positive. So I would say genetic testing empowers us. This is a great power. We're continuing to learn more about which other genes are involved. But if you think you might be a candidate, call your doctor, make an appointment, talk about your risk, and really get on top of it.
Something to think about, something to learn more about. We learned a lot today, though. Thanks, Dr. Payal Kohli.
And you can always find much more of Dr. Kohli's advice, all the topics. She knows everything about everything at 9 News/Dr. Kohli.